Welcome. What are some common physical worries? In this episode, we'll be learning about some common skin, eye and scalp-related issues, as well as their respective treatments. As parents, it's understandable that alarm bells might start to ring as soon as we see a pimple, spot or rash appear on our baby. Of course, there's a part of us that will worry something is dreadfully wrong, but thankfully, there's usually a harmless explanation. In terms of skin issues, it could be sucking blisters, which appear on a baby's lips and tend to disappear in the first few weeks of life without treatment. It could be a rash. Rashes are extremely common in little babies, and they may come up in a variety of different forms. For example, they could present as little yellow or white pinhead spots on the face called milia. These are due to immature sebaceous glands and will disappear. Some babies have widespread blotchy red spots with a yellow centre on the face, leg and torso, which come and go over the next few days. This is erythema toxicum and is harmless. They will also disappear. Although a rash in a newborn baby is almost always harmless, there are some rash-related illnesses such as meningitis which can be life-threatening. Call a doctor if you're worried about a new rash on your baby and they seem unwell. Or perhaps the rash is thrush, a yeast infection that can sometimes affect a baby's mouth or nappy area. If a baby's mouth looks as if it has patches of milk curds stuck to their tongue, cheeks, or perhaps the roof of their mouth, this is probably thrush. Your doctor can easily prescribe a medicine to get rid of this. If thrush affects the nappy area of your baby, you'll get a red, spotty rash, and this also can be treated by a special cream that you can get from your doctor or your pharmacist. Between 5 and 10 days after your baby's birth, their umbilical cord stump should naturally fall off. Although it may be difficult to know how to deal with this, remember that this process has to happen to every single baby. Before it separates, the stump will become dry, but it may also become sticky. This is a normal process. Don't worry about this unless there is any redness in the skin surrounding the stump or it is very smelly, in which case ask your midwife to take a look. In terms of eye issues, it could be a blocked tear duct. Symptoms include a weepy eye and white gooey discharge. To treat a blocked tear duct, very gently massage the tear duct, which is below the eye, several times a day with cotton wool dipped in cooled, boiled water. If the symptoms don't seem to be disappearing or things seem to be getting worse, talk to your doctor. If the stickiness becomes yellow or green or the whites of the eyes become pink, ask your doctor as your baby may have conjunctivitis, which will need antibiotic eye drops. Your baby may have crossed or squinty eyes. These usually occur because the baby's eyes haven't yet learned to work together, but will often sort themselves out on their own. Finally, in terms of scalp issues, if you can see that your baby has developed a swelling on their scalp, this is probably due to caput or cephal hematoma, which happen as the side effects of birth. Caput is a swelling of the scalp which causes it to feel spongy. Meanwhile, cephal hematoma is a build-up of blood beneath the scalp caused by high pressure during a vaginal birth. Although this may alarm you, try not to worry. This type of problem should go away naturally on its own. Caput usually disappears within a few days, but a cephal hematoma can take a few weeks. It's important to remember that even if something seems visibly shocking or affronting, it doesn't necessarily mean it's anything serious. Nevertheless, if you are truly worried about a physical ailment, then always talk to your doctor or health visitor. This will put your mind at ease and help you to learn more about common symptoms, how to relieve them, and anything particularly serious that you should be looking out for. So to recap, if you are over-worried about your baby's physical ailments, you are not alone. There are many physical ailments that are extremely common for small babies. If in doubt, talk to your doctor or health visitor.